Pamintuan of the Philippine Star. Lucy and Robbie, happy Tuesday.
Good evening to you both.
Happy Tuesday.
I'm so happy. Parang when we greet each other now, happy Tuesday.
Yeah. Well, we were
and then we launch into the numbers.
Yeah.
Para
we were talking about the numbers today. I think it's a bit lower than the previous day, which is I suppose a good thing.
More than 5,000, yes.
Yeah.
But
Still a bad thing, but
4,000 levels.
it's a better thing than
Yeah.
we've been worrying about in the past few
Yes.
days. Kasi
Yeah, well,
it had
I
been
mean,
escalating.
among other things, one thing is over.
Mr. Glass half full, CM.
Yeah, di ba?
And unfortunately, among other things, one thing it's all overshadowing is the date. Diba? I mean, we're all celebrating the 500th, the quincentennial of the Philippines. Ano ba, Bok?
I was telling Robbie kanina.
Sabi ni Yoyoy Villamil, March 16,
There was also some controversy over
1521.
that eh. Di ba, ang sabi nga ni Yoyoy, well, among other people,
Immortalized by
di ba,
Yoyoy.
March
If you
16,
forget your
1521.
history.
1521.
Yeah, but
Pero
some
there
celebrations
are
start
those who
tomorrow.
say na nagkamali si Pigafetta because he did not take into account the crossing of the international date line. So in the Philippines, it was March 17. So in fact, in Homonhon Island, where Elcano and Magellan were supposed to have landed no March 17, they're celebrating it tomorrow pa. Well, celebrating in quotes. Bukas pa sa kanila ang arrival anniversary.
Tama na, inimmortalize na ni Yoyoy eh. Huwag na natin ituin.
Okay.
Inayan.
Fact checker eh. Fact checker.
Sige. Respetuhin natin si Yoyoy. I remember his other song, si Borok Punta Ilog. Let's not go into that. Okay. Well, of course, as we told you a while ago, we are going to again discuss the issue of COVID and hospitals this time. Of course, we've been doing that for the past few weeks, but for obvious reasons, this is a major issue. So we bring in for tonight our first guest, Dr. Jonas del Rosario of the Philippine General Hospital. Doc Jonas, thank you po for joining us again, and welcome back to Chiefs.
Happy anniversary, 1 year. Magandang gabi po.
How are you?
Magandang gabi po.
Talagang happy
Happy
anniversary.
anniversary talaga, Doc, ha?
Happy anniversary. Halos mag-iisang taon na kaming COVID referral center sa PGH in 2 weeks' time.
Oh, okay. I was wondering if you wanted to say happy anniversary because of the 1521 event or because of the 2020 event.
Pareho po. Gustong-gusto ko po yung kanta ni Yoyoy. Wag mo, March 16.
Oh, well, nakikwento lang sa akin ng tatay ko yun eh. Pero anyway, Doc, let me start off with this po. Of course, you have heard na over the weekend, people were really alarmed over those reports coming out na major hospitals in Metro Manila, nagpupuno na yung kanilang mga COVID wards. We're talking, of course, about St. Luke's, Cardinal Santos, Makati Med, and even, I think, Asian Hospital. Kayo po, bilang ospital ng bayan, kamusta po yung inyong mga numbers? How are you doing?
Well, right now, as we speak, our last number is 157. That's the number of COVID patients we have. This is the biggest in 4 months, no? It reminded us of what happened just before, maybe a week before we were asked to be a COVID referral center. Nung time na yung mga private hospitals were asking for help and asking for the government to come in, try to designate a COVID referral center, 1 or 2 hospitals wherein we can centralize the efforts against COVID. So yeah, nasama po yung PJ. So halos isang taon na, ganito rin. Puno na po yung mga St. Luke's, Makati Med, Medical City, other private hospitals. Sa ngayon po, we can also feel the surge, no? Kasi just about middle of February, maniwala kayo, ang aming mga pasyente na lang ay mid-60s na lang eh.
Oh, dumable. Triple.
Parang pagsipa nung last 2 weeks of Feb, lalo na pagpasok nung March, very steady yung increase namin to a point that we were admitting almost like 10 to 15 new patients a day. At ito na nga po, right now, as we speak, 157, but there are a few more waiting in the wings to be admitted, no? So clearly pataas talaga. A reflection of what's going on in the community.
Doc, I think I heard you yesterday even use the word umaapaw. Of course, iba yung nararamdaman nyo where you are for your specific hospital, and we know PGH is so central to the anti-COVID campaign. But over the past few days, maraming nagko-qualify, sinasabi, no, let's look at the national numbers, ito yung bed capacity when you look at it on a national level, and then they qualify. But then, of course, the majority of the cases are in Metro Manila. What really is the relevant number to look at? Do we look at the national number, or do we focus on our capacity in NCR?
I think you have to look at both. So there are definitely areas naman sa Pilipinas na they're not feeling the surge right now. And as you know, the Philippines is an archipelago. Talagang may mga lugar na hindi naman talaga densely populated, dikit-dikit ang mga tao. We already know from the very beginning what are the regions which really represent the high transmissibility or the high numbers. Andyan syempre yung NCR, Metro Manila, Cebu, Davao, parang yan naman talaga, you know. Now, if you look at this, yan talaga yung kumbaga epicenters of COVID. So talagang we have to look into this kasi whether you say in toto, maliit, if you take parang every region in reality, but you have to really pay attention to the main regions, which are basically the drivers of the illness, no?
Well, Doc, to simplify things, sige, let's look at NCR lang. I understand last night kay Dr. Beverly Ho, yung NCR COVID capacity natin is mga 70% ata for Metro Manila. That number against yung mga numbers dun sa the hospitals I mentioned, the Makati Medical, Cardinal Santos, what are we missing out on here? What's the nuancing that we should understand here? You have 70% versus major hospitals na napupuno. Is this cause for alarm? Are we missing out on anything here?
Well, you have to understand that each hospital sets a limit to the number of beds that they are willing to allocate for COVID. No? The government has asked a minimum of about 20% of their total bed capacity. So, Hospital A can just say, okay, ang pwede ko lang ibigay 50 beds. Yung isang ospital, kaya ko magbigay ng 150 beds. So, it's really up to them what kind of denominator they are going to tell us, hindi ba? So, pag sinabi nilang 100%, ano ba yung 100% nyo? Ilang beds ba yun, no? So, and I know that the private hospitals they have issues also in taking care of COVID, and I'm not really in a position to talk about it, but it has been mentioned in several news before that reimbursement is a problem. They don't really get enough support as a private hospital, especially the smaller private hospitals. No. Samantalang kung kami PGH COVID Referral Center and some of the other designated government hospitals which are taking care of COVID, medyo supportado kami ng government. I have to say, at least we never felt like we were being left out kung anong kailangan namin. So that's the advantage of a government hospital. So now, sometimes when I look at sinabi ng ganitong hospital, puno na kami, it's probably that's all that they can afford. Otherwise, baka malugi sila. Something to that effect.
Ami Pamituan of Philippine SAR.
Hi, good evening, Doctor. Doctor, hindi lang mataas yung mabilis yung transmission, diba? And the Octa is warning that baka daw by the end of the month, mga 11,000 na, pumalo na ng 11,000 a day yung number of fresh cases. At what point will the hospitals be overwhelmed? Siguro natin dun sa mga COVID referral centers muna.
Well, ngayon po, pumapalo tayo. We're hitting like 4,000 to 5,000 a day already. And now we are about 80% full. Ito yung PGH. No? We actually, what happened was, just to backtrack a little bit, we actually contracted our operations for COVID because it was getting smaller. And so now we had a chance to reopen our non-COVID wards, open the rooms, convert some of the COVID wards to non-COVID operations. And so now we're trying to get it back. Kaso ang problema, nandiyan na rin yung mga non-COVID, no? So we went as high as 240 at one time PGH was able to give those beds. But at that time, the non-COVID patients were still afraid to go to the hospitals. Kaya parang madali sa amin na, sige, buksan lang natin. Total, wala namang pumupuntang mga non-COVID patients. But then there was a lull that's when the non-COVID patients, now the patients with cancer, heart diseases, kidney disease, who needs dialysis, ayan na sila, pumupunta na sila sa hospital. Now they are in our hospital. It's so hard to recover these beds because they are there, physically there. You cannot just move them and, okay, let's... So right now, PGH is, we have stretched our beds again for COVID to almost close to 200. And we have about 160 over 200. So almost, 80%. Now, you were saying that kung 11,000 or 15,000 a day, ay siguro, kung ganun talaga ang rate, baka in 2 to 3 days, wala pang isang linggo, puno na rin kami, puno na rin yung iba. Because, there are no other, if the hospitals, the big hospitals, the major private hospitals say that they are full, ay saan pa pupunta yung mga tao? We have some of our private patients actually, but these are actually patients who probably could not just get into the private hospitals kasi puno na sila. So no choice, they have to go to PGH. No, majority of our beds are for the charity patients.
But there's actually a possibility that you will be overwhelmed kung ganyan ang mga numbers.
Pwede po. Kasi, well, right now we're okay. Parang kaya pa. But the problem is, once you do not have, I think I mentioned this in the news yesterday, we can say that we're better prepared, we're knowledgeable, we have the 1-year experience of taking care of patients. But if we do not have the rooms or the space in the hospital, how are we going to take care of them? If they will be staying mostly in the outskirts of our emergency room or yung iba, kalat-kalat po, napakahirap, no? The other, obviously, the other concern will be manpower. Right now, we're okay. We were able to get most of our nurses back. We have doctors, trainees, consultants who are manning our COVID wards. We're still okay. But what we have experienced in the past is eventually people get tired, people get sick. Isa na hawa po. Kaya mahirap, no? We have actually a request from DOH if we could get some more volunteers again, maybe about 30 to 40 medical doctors / nurses, medtechs from DOH. We do not have the budget to pay for these people anymore, so we're asking DOH maybe if they could pay for their salaries and augment our workforce. Pang ano lang ba? Pang sub, kumbaga pahinga lang,
Pero,
no?
Doc,
Parang relyebo.
pero Doc, di ba yung mga interns nyo, well, that's what I'm hearing, no, na hindi nyo raw ulit pinapapasok.
Alright.
So, pati hindi na lang yung mga yun.
Oo nga, that's a very good question, Luchi. No? Where we are actually conflicted. No? For one part, it's good to include our interns to be part of this battle with COVID. Let them also take care of patients. Pero ano pa sila parang they're still students, really. They're still undergraduates in our eyes. We don't really want them to be unduly exposed to COVID. These are our future doctors in a way, no? So parang if we actually allow them to come back when the COVID suddenly went down, the COVID numbers, because they also need some type of face-to-face education. You know, they need
Yes, and experience. Yeah.
Exactly. I mean, just imagine most of the interns, the batch of interns now, hasn't probably gotten at least 2 months of clinical exposure. Like being at the bedside, seeing patients, it's all like like Zoom or webinars and online. I mean, that's nothing. I mean, that's really, internship is really hands-on. They go to PGH to learn and be able to do procedures. They're not getting that.
Doc, as you said, sa PGH, okay pa kayo. Is that representative of other public hospitals? What's the situation when it comes to manpower, human resource in other hospitals?
I heard Dr. Rogin Solante from San Lazaro. He also sort of like said that kaya pa, no? Pero medyo nakaka-alarm yung nangyayari at maaring ma-overwhelm din sila if it's unabated, tuloy-tuloy lang ang pagtaas. I think we are at the, parang wala pa naman tayo sa tipping point, pero mga namumuro, malapit eh. So that's why I think we have to be proactive and try to nip it, no? Na baka meron pa tayong dapat gawin. I think itong mga measures na they're instituting now are some ways, without total lockdown, without going back to MECQ or ECQ, little things, granular lockdowns, identifying areas where transmission is so high. This curfew I think is okay also because it has been found that mga inuman, parties, these are really super spreader events, no? Eh kung at usually naman nangyayari yan after office hours o yung mga ganyang gatherings. So I think this is also one way of trying to slow down the transmission.
No.
That-
Doc, what about in terms of treatment, no? Kasi ang mga naririnig lang namin lagi ventilator. Parang nawala na yung usapin ng hydrochloroquine or I don't know what other treatments you have,
Okay.
especially in the early stages when they say those medicines could help. Are you more knowledgeable, quote unquote, in terms of handling those cases that threaten to move from mild to severe?
Right. Well, it has been a 1 year's worth of clinical trials, evidence, trial and error, trying to learn from the best practices. Right now, I think the first thing that has to be emphasized is prevention. Okay. Now, as a host, someone who is going to be exposed to COVID, it's very important that you take care of yourself. Talagang you have to equip yourself, try to boost up your immune system. So sabi nila, huwag ka magpuyat. Control your metabolic disorders. Kung ikaw ay diabetic, make sure your sugar is low. If you are hypertensive, make sure your blood pressure is under control. If you have kidney disease, make sure your creatinine. So these are little things that you have to do for yourself. Exercise. Sleep is very important. They mention about some people have vouched for this and there are evidence for it like vitamin C, vitamin D is important, zinc.
Yes.
Yan, yung mga yan. So at least right off the bat, I will tell you that you have to do your own personal care. Okay?
Okay.
Decrease your stress level. Okay. Now, ang issue is, ano ba yung mga gamot na parang proven, no? Apparently, hydrochloroquine is a very popular drug before as a prophylaxis and as a treatment for mild disease. Right now, evidence shows that it's not really, it's not being recommended anymore. So hydrochloroquine is out.
So as far as cure, wala.
Wala pa. It's all like, we're still, these medicines are usually for those who get hospitalized. Yung remdesivir, nandyan pa rin. Nandyan
Yes.
pa rin yung tocilizumab, nandyan pa rin yung dexamethasone. Sometimes they throw antibiotics just to control bacterial infection. And then as you get deeper into the illness, siyempre may mga hemoperfusion, dialysis, the convalescent plasma now, which I was one of
Yes.
I was a proponent.
Right.
What we learned was you have to give it early. If you give it quite late in the game, let's say the patient is already severe or critical, it's not gonna work. So it has to be given in the early part of the illness. So
mga
yes.
herbal, do you work? Kasi
Sorry?
yung mga herbal, kasi tinatawag ng COSP eh. Are they actually being used in the hospital?
Wala.
Supplement treatment daw?
But ano po bang herbal?
Virgin.
Mga virgin coconut oil.
Well, you know,
Yeah.
yan namang virgin coconut oil, even before COVID, it's being used as a immune regulator, immune modulator, so it has so many uses. So there's nothing against it. The problem is we don't have clinical trials for it, but people have been using it, so I don't have a problem with it. Ano pa ba yung sasabihin ko? Well, the other thing is we try to avoid intubating patients, ventilator if we can. A lot of the patients who get intubated, especially if they are senior citizens, high risk of mortality. So we try to give as much as we can just oxygen, or there's a thing we call high flow oxygen. You're delivering enough oxygen without intubating them. There's a certain machine. So
Yes,
it's quite helpful.
yung by, ano ba?
Doc,
Yeah.
one thing unique sa PGH is nabakunahan na kayo, yung mga staff nyo, at the same time, you have a sense of how to roll it out. Now, people reading the news the next day, they'll just try to put two numbers together. Ilan na ba bakuna dito sa Pilipinas at ilan na nabakunahan? Why is there a gap? As far as you could tell, what can you tell people that we don't know kung bakit hindi necessarily kung 1,000,000 ang bakuna dito sa Pilipinas, 1,000,000 bukas ang mababakunahan?
Well, you have to understand it's not that easy. You cannot vaccinate. Let's say, let's look at PGH. We have about 6,500 recipients. Okay? Pwede mo sabihin, sige, 1,000 araw-araw para 1 linggo tapos na. It's not that easy because it's not just jabbing or inoculating the vaccine. You have to monitor these people. The monitoring is as short as 15 minutes to as long as 1 hour. So even if you are actually vaccinating, let's say, actually, na totoo lang, from the registration, yung screening, and the vaccination, kaya na 5 minutes tapos na lahat yan And then there's this post-monitoring, which is about 15 to 30 minutes. If you are overdue, if you're too fast, then maiipon naman sa monitoring. So physical distancing has to be practiced, right? So there's a certain number of depending on the physical space that you have. You have to account for physical distancing. Hindi pwedeng dikit-dikit kayo. So doon bumabagal. So right now, our rate is na parang relax ka lang, hindi ka na mamadali, parang hindi ka pinapaspas yung mga inoculator or vaccinator, hindi na i-stress. We're vaccinating about 450 a day. No? So really, if we have about 6,000, 2 weeks and that's what's happening also in other places. In fact, in some other places, it's probably even slower because they have less vaccinators, they have a smaller space. And then you also have to factor in these vaccines have to be rolled out in some other areas. Babiyahe mo yan, merong storage system called the cold chain, cannot be broken, so you have to rely on sometimes third-party companies to make sure that the vaccine is preserved. So marami po. But the main reason why it's not that fast is it's not simple just injecting everyone. You really have to monitor them. If something happens, you have to have a system wherein you have to, let's say an anaphylaxis sets in, you have to have a team to do that. So ganun po, may proseso po.
Okay.
Doctor, apart from the longer curfew, ngayon binawalan na naman yung mga below, 17 and below, tapos mukhang i-restrict na naman yung incoming flights. Ano pa yung gusto ninyong makita by way of containing this spike in cases?
I think what we wanted to see is to limit the opportunity for people to gather. And so if, sa ngayon po, binabawalan na namang lumabas. So really, I think the intention is try to break any opportunity that these people will celebrate on something or go to a certain place na nagkikita-kita sila. Because yan yung nakita, when people, we increase their mobility, we actually sort of like tone down a little bit on the restriction. So people eventually slowly are getting together. Hindi nyo napapansin, meron ng mga nagbabakasyon sa kanilang mga resort, hindi ba? Makikita mo medyo nagkakadikit-dikit na. So hopefully by doing this, putting some restriction again. And anyway, these people less than 18 and more than 65, they're not really working. They can actually do all of the things that they need to do at home. And let the people who are what we call essential workers be the ones out there in the streets and do their daily activities.
Well, Doc, before we let you go, I'd like to squeeze in one more question. I'm sorry, pero I need to ask you this kasi you're a doctor and you're involved here. Si Secretary Duque kasi and Secretary Galvez are proposing that all the AstraZeneca vaccines already on hand be used as first dose instead of putting aside 50% for the second dose 2 to 6 weeks later.
Yes.
Does that make sense to you? Considering that we don't even know when the next batch of AstraZeneca vaccines are going to arrive. I mean, does it make clinical sense?
It makes sense for me. I would
It has a
rather...
short shelf life daw. Totoo ba
Exactly.
yun?
Well, you
Yeah.
see, you probably know that the expiry date of the batch of AstraZeneca that we got from COVAX is May 30, 2021. Okay. The recommended what they call spacing now, or interval from the first dose to the second dose, is 12 weeks.
Right.
That's
So
3
that's
months.
3 months, right? So that's 3 months. So
August.
if you give it now, let's say, as we speak, March 17, 3 months will be June 17 or June 16, right? Expired na.
So beyond. Okay.
Expired na. So sasabihin ng iba, sige, ilapit na lang natin para sayang naman bago ma-expire. Okay. Okay. Now, the reason why it's being proposed that way na 3 months, they found in their studies that if you delay the second
Yes.
dose, the level of immunity will be much higher. Okay. So I would rather get that advantage. Of course, everybody's afraid. Baka hindi dumating yung second dose. But I would rather spread out the
Yeah.
vaccine. At least, mas madami kang mabakunahan. Everybody gets a single dose. Make some level of protection.
Yeah.
Anyway, after a first dose naman, some will say 60%, 70%, medyo protected ka na. But then at least mas marami kang mababakunahan. Kahit sabi mo madelay ng konti, I think kung 12 weeks dapat, dumating ng 1 month or 2 months later, you're still okay. Because actually, studies show that the longer you delay the second dose, the response will be better.
Wala namang maximum yan, sir. Although baka we don't know yet. Ha?
Wala
Wala
pa
namang maximum
wala
yan.
pa. Hindi pa alam. Oo. Siguro hindi naman dapat next year, di ba?
See.
But Doc, that's the effect. Doc, that's the effect on the second dose. By the time you get the delayed second dose, mas malakas yung effect ng second dose. But in that window na dinelay ko yung second dose ko, do I also have a heightened risk?
They said that, from what I understood from what people said, when they look at data on just before the second dose, they get levels of antibodies. And they saw that it's higher when you delay it before the second dose. So that means merong, you
So
know,
before.
they develop,
Meron ka ng
development na
protection.
nangyayari.
Yes,
Meron
yes, yes.
Meron na. Kasi ang nangyari naman, this 1 month interval was based on a clinical trial. No? But, eventually, people modify the trial as they go along. They will try to, okay, let's try kung 2 months ang interval, 3 months ang interval. In fact, in a lot of countries, they say that just give the first dose and try to vaccinate as many as you can. Because, the bottom line is, it's better to vaccinate 1 dose to a larger population than half of the population, tapos the rest are unvaccinated. So, di ba?
Okay.
Okay.
Okay. Dr.
Alright.
Jonas Del Rosario of PGH. Doc, maraming salamat po at ingat parate.
Maraming salamat
Salamat,
po.
Doc
Ingat kayo.
Jonas.
We'll just go into a break, so please stay with us.
Welcome back to the Chiefs here on One News. We're now in the final stage of our conversation, and with us is Dr. Jose Rene de Grano, President of the Private Hospitals Association of the Philippines. Good evening, Dr. De Grano.
Yes,
Good evening,
Good evening po.
Doc.
Good evening po. Yes.
Doc, we'll go straight to the question and the concern of a lot of people. A lot of hospitals, including private hospitals, are saying, okay, we're hitting critical levels now. We are afraid na baka we might run up against the limits of our own facilities. Is what's there to qualify there? And are we getting near the point of having to ask for another timeout?
Right now, actually, the experts are saying that no, not yet, because right now we already have some experiences with the past, and so we can manage this COVID patients better than before. So with that, at least we can probably hold out much longer.
What's how much longer on the, let's take the numbers over the past few days. Medyo bumaba today, but it's still more than 4,000, 5 straight days already. Let's take the numbers of Okta Research predicting 8,000 if nothing changes by the end of the month, 18,000 by the middle of April. Will that cover, I mean, how much longer we can hold out, in your words?
Well, actually, the figures are really alarming right now. And before, I was thinking that after probably another 4 weeks with that continuing trend, then probably we'll have just like the August 2020 uh, situation where there were full houses or full COVID beds in almost every hospital. Hopefully, it doesn't arrive at that scene.
Doc, ang sabi po ng DOH, sabi ng DOH kasi sa Metro Manila, yung COVID occupancy ng mga ospital nasa 60 to 70% lang. So, kahit pa paano raw, hindi pa naman ganun kalala. Pero I'd like to ask you to qualify that kasi what we heard nga, and that's been confirmed, yung mga major Metro Manila hospitals, fully booked na po yung COVID wards. Yung Medical City, Asian, St. Luke's, Cardinal Santos, ito yung mga malalaking ospital. So, I suppose what that means is that yung mga maliliit na lamang na ospital, yung medyo meron pang existing COVID beds. But then again, magkakaiba po resources ng dalawang yan. Di ba? Yung big hospitals have all the resources, have all the manpower. The smaller hospitals do not. So is there anything to qualify there po? Should we be reassured by that 70% or should we be worried with that?
I think we should be a little bit worried already because there are around 159 facilities in the NCR.
Okay.
And out of the 159 facilities, around 20 facilities are in the critical level already. And another 23 are in the high risk level. When you say high risk, it's 70 to 85% occupied. And if it's critical, it's at least 85% up to
Higher.
full capacity.
Okay.
Yes, and there are 20 facilities that are already in that point.
Well, that's a long way from 159. So why should we be worried? I mean, that's how it looks to a layman, no? So there are 20 hospitals na nandun na sa 70, another 20 or so na nasa, you were saying 85, but that leaves 100 or so more. So is that worrying?
Yes, well, in a way. Actually, the occupancy rate in NCR is only around 52%, 52% all over Metro Manila.
In
That's why
NCR.
there are still actually open beds in other hospitals. But of course, if you're the patient, you are
Yes.
usually running after your doctor.
Right.
The hospital that you want to be admitted into.
Yun no?
Ganun
Yeah,
po
it's
These are
it's
the big
the
hospitals.
preference, no?
Yeah, it's your
It's the
preference.
preference, yes.
So,
So
kahit
we're
hindi
talking
open.
about, yeah. So just to follow up on Ed's question, how many of those 159 would have, well, sabihin na lang natin, sufficient facilities that can reassure a COVID patient that he will be given or she will be given, sufficient treatment if they book there.
Well, some of these hospitals, actually, the cases right now are not really that, the severe and the critical cases. No, 90% of the cases right now are mild, and some are asymptomatic. So actually, the asymptomatic patients go to the quarantine areas, and then some of
Yes.
the mild asymptomatics go to the hospitals. And there are probably 1.5% or around 3% which are severe or critical cases. So, pero most of these cases, if you go to the critical side, because most of these patients are the senior citizens, and so there is a high fatality rate usually for these patients.
Pero doctor, on the other hand, yung worst case scenario, no? At saka seeing the trends in recent days, kahapon more than 5,000. Saka yung Okta nga, tinanong na namin ito kay Dr. Del Rosario kanina, yung Okta predicting up to 11,000 by the end of the month daily. Sabi niya, kapag nagpatuloy itong trend na to, with that spike, with the speed of transmission, in 2 or 3 days, kayang ma-overwhelm yung facilities ng government referral centers. Ha? Is this also the same with private hospitals? Ganun kabilis ba yun?
Yes po. Actually, mas limited ang resources ng private hospitals. First, funding. Two, our staffing. Yun ang problems ng mga private hospitals. The government hospitals, they can always have funding. They can always ask for government for their funding. But private hospitals, limited po ang funding ng mga hospitals. Usually, ang income lang ng private hospitals come from their census or their admissions. So, and PhilHealth, of course. Right now, medyo nagkakaproblema rin po ang payment or reimbursement ng PhilHealth. So, ang mga private hospitals talaga po, most of the private hospitals are resorting to downsizing. A lot of private hospitals have downsized already. In our own hospitals, from 150 beds, we went down to 95 beds because we only have a few nurses already. And other hospitals are doing that also because the census.
Tumababa
Bakit
actually.
bakit kumukonti ang mga nurse?
Well, alam nyo naman, they have already opened actually the overseas applications for nurses, and also the government is competing because they are they are offering higher salary for nurses. And so pumupunta po sila
So
kahit
there is
But,
a shortage.
but sir,
in a
exactly.
way.
That's precisely what everybody's been trying to wrap their heads around. On the one hand, my deployment, and yet every time we
Yes.
talk to the Nurses Association of the Philippines,
Yeah.
they also always emphasize, actually, there's an oversupply. There's a glut of
Right.
nurses na walang trabaho ngayon.
Well, Dole is, Mr. Bello is saying that there are 400,000 nurses. Where are the nurses? Then they can just give us the nurses. But there is none. The truth is,
Why
a
is
lot of
there a
nurses are going
discrepancy?
out.
So basically, no takers. Basically, what you're saying is there are openings, and it's probably true because we have gotten it straight from the Nurses Association of the Philippines, not just the Department of Labor, where they say there are hundreds of thousands of nurses without jobs. So is it that there are openings, there is need for this job, never mind the jobs that they're taking abroad, but there are no takers for the nurses' position here in our hospitals?
Yeah, well, I don't know. Maybe a lot of them are already preparing to go overseas. Marami sigurong pero a lot of them have already, in our own hospital, at least around 20% have resigned in the past 3 or 4 months. And that is true for almost all of the other hospitals.
20% po sa iba rin.
Nag-downsize kayo. Ano yung mga empleyadong dinownsize nyo? Kung ganyan nawawalan pala ng nurse eh.
Aside from that, yung ibang non-medical, we have to do some hours reduction or work from home or something like that, or furlough for the other employees. so that at least we don't have to retrench them. So we just give them reduced working hours.
Ano po ba yan? Is that a question of salaries? Is it because the government offers higher salaries than private? Or is it the other way around? Because our impression really was there's so many nurses just waiting to be called by government hospitals, but no one is hiring them or calling them. So what accounts for the discrepancy between your numbers and the numbers of the Nurses Association?
Well, I think a lot of it has to do with the salary then, no? Kasi they are offering at least 32,000.
Sa government?
Government.
Yeah. As a
Although they
private.
don't realize that is temporary, you know. That's they call no, on
Yes,
the job or
yes.
something like that.
Contractual.
Hindi yung permanent. Only for
Yeah.
for the duration of the pandemic.
Contractual.
Doctor, what
yes.
about how does fear and fatigue factor into the decision of nurses whether or not to take the jobs?
Well, in a way, probably, but they only have to take a rest for 1 or 2 weeks, and they're already back. You know.
Re-energized, ha?
Yes, of course.
Yeah, dapat.
They just take a rest usually if they really wanted to work.
Yeah.
You know, because in other private hospitals, the salary is around already 25,000 plus perks. Some perks like free
Benefits,
accommodation,
yes.
free
Yeah.
meals, like that.
Yes.
That's on the fatigue
Oh.
side. That's on the fatigue side. What about on the fear side? I mean, now they can have access to vaccination. Is that having an effect, at least in terms of encouraging and providing incentives?
Yes, actually, we have some nurses in our facility, and when we said that if you are given vaccination, would you like to stay? Well, they said that they retracted their resignation. So, but we have to ask them to at least extend their work for anotr year probably.
Musta naman po yung pace of vaccination sa private hospitals? Are you happy with kasi priority naman ng mga healthcare workers. Okay naman ba sa inyo yung progress ng vaccination? Considering our resources, of course.
Medyo, yung iba pong actually, yung ibang hospitals, private hospitals for that matter, medyo nagreklamo kasi medyo daw mabagal. Ano? Because there are a lot of requirements na hinihingi ang Department of Health. No? And there were some miscommunications.
Ano po yung requirement?
Ang dami sila, mga advisory, you have to fill this up, etc. And those things. And the vaccines have to be, it's either you wait for them to deliver the vaccines to you, or you pick them up. If you pick them up, then you have to have an escort, military escort.
Yes.
Military escort, going there and going back.
Oh, wow.
You know, and
Wow.
it has to be placed in a container and storage box.
Right.
It is controlled 2 to 8 degrees. So actually,
Ano
it's
yung
not that easy.
mga hospitals to store, sa storage?
It's
Sa Metro
easier.
Manila, mga hospital sa Metro Manila, fully equipped ba yung mga private hospitals for storage of the vaccines?
Yeah, for storage naman po, there should be no problem because it's the usual refrigerator lang po naman eh. Yung 2 to 8 degrees, you can use the bio-ref or just the regular refrigerator.
For the medicine?
Yeah, for the medicines and the vaccines. Yes po.
What about other workers like medtechs, yung mga ibang health workers dyan? Sufficient naman yung numbers nyo. And then, you're talking about, I don't know, other services like your blood bank, for example. Are those sufficient wherever you go? I mean, how many of these private hospitals really will be able to deliver whatever services might be needed in order to heal or treat the patients?
Most of the level 2 hospitals and level 3 hospitals are complete for COVID patients, actually. The level 1 hospitals, they usually, if they get COVID patients, they refer it to the higher level 2 or level 3, because they do not have sufficient equipment and probably manpower to manage this, the COVID patients. Pero we have also our own medtechs, our pharmacies, X-ray technicians in the hospitals, and they are sufficient because they cannot easily go out, unlike the nurses. Right now, they are open for nurses, but for the other medical, they are not yet open. So
They're not as in demand abroad, I guess.
yes,
No?
yes.
That-
They
yeah,
are
that's what
actually
you're
in
saying.
demand.
Yeah.
They are actually in demand, but they are not allowed to go out yet. Only
I
the
see.
nurses. Yes.
Ano yan, sir? Ano pa rin sila? PPE, naka-mask, talagang kumpleto pa rin yung gear
Yes,
sa
of
mga
course.
ospital.
Of course.
Yeah.
That's why it's actually safer to stay or to go to the hospital. I don't know why
really?
the people are really afraid
Yeah.
of going to the hospital.
Oo,
Because,
sir. Ako, napapraning talaga ako mapunta sa ospital. So,
Yeah.
you mean it's actually safer?
Yes,
Talaga?
because people there are really follow. Supposedly, they should follow strict health protocols.
Oo nga
Unlike
naman.
in the malls, you see people there wearing PPEs, complete PPEs. No, but in the hospital,
Kasi wala
they
namang
have to-
shopping sa ospital eh.
but they have to have their routine checkups, their follow-up checkups.
Yes,
Kaya
yes.
marami kasing na right now nadidisgrasya because of the
Right.
chronic diseases na hindi na-follow up. And then when they go back, medyo serious na. Kaya dapat we should encourage people to go back to the hospitals, even for telemedicine. No? If they don't want to go there, use the remote consultation.
Ang hirap kasi, sir, nagpapatest pa eh. Kailangan bago ka makapasok, halimbawa for lab tests, no?
Yes.
Kailangan ka muna magpa-RT-PCR. Doon palang gastos na.
No,
Diba?
actually, in hospitals where usually we have divided the hospital into COVID and non-COVID areas. And if you go to the non-COVID areas, you don't have to do an RT-PCR unless
Baka yung malalaking ospital lang ang ganyan.
unless you are admitted. Of course, if you're admitted, then you have to undergo because we are assuming that you are negative because
I see.
this is a non-COVID area.
Doctor, may controversy ngayon about the AstraZeneca vaccine which is being rolled out sa mga health workers. Anong mood sa Philippine medical community? Are you willing to take it? Halimbawa kayo, personally, are you willing to take the AstraZeneca?
Well, of course, I just had mine this afternoon.
Okay.
And at least I'm still awake. I don't feel sore in my here.
Ganun, meron pala generally yung confidence on the AstraZeneca vaccine sa Philippines within the medical community, okay naman siya.
I
Kasi
think-
tinatanong ko kayo dahil
Yeah.
kayo priority eh.
Yeah, okay. Actually, we have no choice. There are only two choices, Sinovac and Astra. And if you, sabi nga ni Dr. Salvania, whatever is there is the best. Diba?
Sir, so hindi kayo
Hindi ka na
pinipili hindi kayo pinipili at all between the two. Talagang AstraZeneca bigay sa inyo.
We were given the chance to choose. However, yun na lang ang available. Pagdating na sa DOH, sabi nila, sorry, wala na Sinovac.
But would you have wanted Sinovac? I mean, if you had been given the choice, would you have had a preference?
Well, okay lang sa akin, whichever, no? Because my daughter got Sinovac and my son got AstraZeneca.
Okay,
they
mixed
are
family.
both okay. They are both okay.
Hi, Doc. In the meantime, Doc, kanina sa big story, I asked you, I mean, and even here, you in particular and the doctors that we've been speaking to have been trying to put up a brave front and a brave face throughout this day, the past few days, saying na urgent na to, critical na, pero kaya pa. We're not the ones saying na kailangan mag-lockdown. Saan po nang gagaling yan? Because we keep seeing the numbers just going up. Where do you get that confidence na hindi, kaya pa to? And what do you see that gives you confidence na hindi, makokontrol pa natin to? We can keep a cap on these rising numbers.
Well, that's probably our vocation, our calling. And we just have to really fight this pandemic. Otherwise, who will do the dirty work?
Kaya lang, Doc, kasi ang calling namin is to see the glass half full. We keep seeing the bad numbers. Our calling is to put the bad news out there And that's what we're trying to get our sense of, because we want to speak out for you also. Na we could hear the public health experts wanting to be more explicit in telling the policymakers na hindi biro tong nangyayari. On the other hand, we want to believe you na no, this can be put under control. But a lot of that is premised on merong magbabago. Ano ba yung kailangan magbago? Both on the level of the individuals, but also on the level of policy. What needs to change literally over the next few days?
Well, just to segue on that matter, ang problem actually ng private hospitals, I'll just bring it up, of course, is the funding. And we'd like to ask the government to help the hospitals. A lot of hospitals are only trying to survive or are only surviving because they have downsized, and they tried to minimize their expenses. And if government please they should help the hospitals get first, of course, their funding from PhilHealth, which are very much delayed, and that's it. We're not like the government hospitals who can ask for Congress to fund them or have a foundation to give the financial support. But the private hospitals only rely on the patients that they admit. And of course, PhilHealth also. And problem right now, that's the problem.
Po yung average delay sa PhilHealth nyo, reimbursement? Ano?
Well, actually there is supposed to be a 60 day for submission, 60 days for reimbursement. Now, usually sometimes it's 9 months before they can pay, if they
Wow.
still pay. Actually, a lot of hospitals are not being paid. Maybe siguro yung iba patak-patak. But then just an example, one COVID patient, let's say, just a mild case, ang binibigay lang ng PhilHealth is only around 44,000. And the patient has to stay for 2 weeks. If the patient is spending at least 10,000 a day because of the medications, that's another 140,000. And PhilHealth will only give you 44,000. So where will the hospital get the payment or for the excess cost of the patient? Some of the patients are willing to shoulder the cost, but what about the indigent patients? And also the policy of PhilHealth is for NBB for the COVID patients or no balance billing. That means they should not be charged. Who is going to pay for all of those things if they do not pay the hospitals?
Ang dami na sigurong naka-promissory note sa inyo, no, sir? I mean,
medyo.
kasi ganyan ang kalakaran. Pag hindi nakakabayad, di ba, usually promissory note na lang muna. So I imagine that has stocked up over the past year or so, no?
Medyo po. Ay, ganun talaga po.
Pero Doc, I remember nung umpisa ng COVID crisis, problema na po yan. I'm wondering lang if it got worse or if it improved, or when you say kasi 9 months, I don't know if we're looking at kahit pa paano an improvement or a worsening. So give us some context here.
Medyo nag-worsen ng konti po. But it's not that much, kasi most of the COVID patients naman na admitted, as long as they are alive when they go out of the hospital, they are willing to shoulder some of the cost. Ang problem po pag naging fatal, wala na kayong sisingilin.
Oo nga
Mahirap na maningil.
Okay.
Mahirap na maghabol.
But where does that put all those 159 hospitals now in Metro Manila? I mean, financially, are you guys still workable?
Well, I think it's still manageable for a lot of these hospitals because I can see that yun namang mga ibang level 2 dyan na not too big hospitals, they are still open. Yun lang malalaki talaga, katulad ng St. Luke's, the Makati Med, the Medical City, San Juan de Dios, etc. They are almost full. But there are other hospitals na still only 60% occupied.
Okay, Dr. Jose Rene de Grano, the President of the Private Hospitals Association of the Philippines. Doc, maraming salamat po
Salamat,
for joining us
Doc.
tonight.
Thank you po.
Maraming
Ingat po.
salamat po.
Good evening. Sige.
And that'll be all for this Tuesday edition of the Chiefs. We hope what was discussed here will keep the conversation going. Now, before we go, a reminder to our viewers, mask on, wash hands, and stay safe, Philippines. I'm Medlin Gao.
I'm Ani Paminton of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay and we are One News.